My name is Dennis Crawford. I'm an orthopedic surgeon and professor at the University Hospital in Portland, Oregon. Medial knee arthritis, frustrating pathology to treat. We haven't had much for this. We treat the symptoms with things that are mildly effective, and that's frustrating because this disease is not curable at the moment. And so telling patients they have it is difficult for the active people, difficult for laborers. The MISHA knee system is a unique surgical device which is used to treat knee pain. What I tell patients about the MISHA and how it works is that it acts like a tiny little mountain bike shock, taking the pressure off from the bumps of activity. It fights gravity for you, not entirely. It takes about 30 pounds of pressure off the inside of your knee, and rather than transferring it to a different part of the joint, it dissipates it around the knee, allowing you to do more and elevating your threshold for activity. It's clever and unique in that although this concept of taking stress or pressure off a joint is as old as the cane, this is a really remarkable therapeutic for arthritis before it limits you, before it impacts your health, or as we first recognize that. And that's where the breakthrough is, no doubt. I've been working on orthopedic research specific to the knee, specific to cartilage and arthritis for 25, 30 years. And lots of great ideas, but MoxyMed carried this one across the line. It's reflective of the quality of the people there, it's reflective of the quality of the technology, it's reflective of the cooperation between the surgeons in the field, listening to patients, and doing amazing things which make this breakthrough technology, the first new treatment for arthritis in decades, my lifetime. And that's amazing. The thing that excites me the most about the 5-year data is the substance of it. It shows the sustainability of the pain relief, and that's remarkable for any therapeutic. 96% of patients are having clinically significant pain relief at 5 years. 96%. I mean, that's amazing for anything, but our treatment for arthritis, it's knocks it out of the park. One of the things that's really important for me is the return to activity. The vast majority of patients go back to the things that they want to get back to. Patients are going back to running, hiking, biking, and even things like basketball. We don't put a limitation on your goals. I think that another part of the information that we've learned and is published in the 5-year data is the ability to avoid joint replacement. 9 out of 10 patients have been able to avoid that up to 5 years. And so 5 years is a good number. I have patients who are out much longer than that from earlier iterations of the device. I consistently hear from patients who were in those earlier trials who are doing things 8 years out, 6 years out. I've seen so many people come back, and the stories are remarkable. This is really meaningful to patients, not only in that you can help them with their pain, but I don't think I really appreciated how much that pain was impacting their lives until seeing how much they're getting back to. If you're a surgeon considering the MISHA knee system, I would say don't hesitate. We're at the beginning of a very steep ramp-up curve. Patients are going to be banging down the door for this. As the data gets out there, get on the bandwagon. I'm Dr. Dennis Crawford, and I moved to MISHA.